commonalities across all of critical care, whereby hemodynamic management is central to all disciplines within critical care. hTEE in trauma critical care provides an online real-time assessment that can be reproducibly performed. Having the ability to leave a TE probe in place for a prolonged period of time is a huge advantage to be able to directly visualize and episodically assess those patients. And so having the ability to leave a probe in for up to 72 hours covers the vast majority of the patients in the trauma critical care unit. One of the major advantages that we've seen of hTEE in the trauma critical care application has to do with getting to the right answer much faster and being able to iterate and be able to adequately resuscitate a patient much faster, because they really need to get all of this done within the first 24 hours for sure. And to get it done within the first 6 hours, so much the better, and some of it you have to get right within the first hour. In addition to that, in the trauma critical care in the 21st century, we're not just dealing with young patients who have penetrating trauma and such. We tend to have some older patients who have multisystem issues, and so direct visualization with hTEE is particularly applicable in trauma critical care at this time. Using conventional methods like Swan-Ganz catheter to try and figure out whether the patient has responded or not to their volume resuscitation, it's taking a fairly long time to get through a fluid resuscitation protocol. And what they have found is that by having direct visualization information with TEE, they're able to get to the right answer much faster. One of the important aspects of hTEE that allows trauma surgeons and trauma intensivists to be able to get to the right answer and improve their hemodynamic management is the ability to train and educate non-cardiac specialists, so intensivists or trauma surgeons who don't necessarily have any previous experience with ultrasound or previous experience with TE. They're able to pick up hTEE fairly easily and learn how to do this and have an extraordinary impact on their patients within a relatively short period of time. One of the unique aspects here is that the probe, because it can stay in place, can follow the patient from one area to the next. So from the trauma bay to the operating room to the intensive care unit, a detachable disposable probe can assist with hemodynamic management across the board in the trauma world.